Dr. Sejal is an infection control specialist who leads efforts to prevent infections and improve patient safety in healthcare settings. He is also a healthcare leader, infection preventionist at Kaiser Permanente, leading initiatives to improve infection control. She is also senior wellness advocate, focus on preventing infections and enhancing health outcomes for older adults. She also has very strong academic credentials. She holds a DNP in population health, MHA in hospital administration, and BS in microbiology and biochemistry. She is also committed to the safer healthcare, dedicated to making healthcare safe and effective for better health outcomes. So we are very excited to have her as our panelist today evening, and welcome Dr. Sejal.
Mr. Som, Dr. Deshmukh, Baina, and the organizers, and all of you for being here today and allowing us to share our pearls of wisdom with all of you today. I have no conflict of interest to disclose. The information I share with you is designed to enhance your day-to-day lives. It is not meant to replace any information that your doctors are sharing with you in terms of your care. So some of you may have heard that 88-year-old Pope Francis was recently admitted to the hospital as his bronchitis worsened, and he was later diagnosed with pneumonia. We are in the winter season here, and with all the respiratory viruses that are going around, it is the season for respiratory illnesses, which poses a health risk to all of us, definitely for adults. Good evening. My name is Sejal Naik. I'm a certified infection preventionist. I hold a doctorate in nursing practice in population health from the University of San Francisco, and I'm a registered nurse by trade. My objective today is very simple and twofold. I want to help you identify the risk of infections in the community, and I wanted to share some basic strategies that you can use to prevent infections. Did you know that hospital admission rates for infections are 3 times higher in the elderly? Older adults account for more than 70% of emergency room to hospital admission. And almost 50 to 70% of seasonal flu-related hospitalizations occur in people ages 65 and above. Some of the common infections that we see in the community are respiratory infections, like the pneumonia we opened up with, skin infections, and urinary tract infections. There are many more, but these are the most common infections we see where we have members from the community being admitted to the hospital. So why does that happen? Adults have chronic conditions such as heart disease, diabetes, kidney disease that all increase the likelihood of complications. They may have muscle weakness, which makes it difficult to cough out all the mucus from the lungs. As a result, the mucus can also collect in the lungs. This muscle weakness also causes swallowing difficulties, and sometimes people can aspirate on the food that they eat or the water they drink. Aspiration is basically food and water going into the wrong pipe. So instead of your food pipe, it is going into your air pipe. And when that happens, that food particle or the water droplet gets into your lungs. As you know, our mouth also holds millions of germs that are sometimes natural for them to live in the mouth. But when someone aspirates, all of the germs also have the potential to enter into your lungs. And when that happens, a person can end up with pneumonia. This is also an issue in elderly patients because we also have weak immune systems as we age, and that lowers our ability to fight infections. So we talked about the 3 common infections that we see, but from a prevention perspective, I am going to talk about general infection prevention strategies that you can employ from the house, from where you live. The first one we will talk about is vaccination, hand hygiene, meaning cleaning hands, ensuring our environment is clean, safely using the antibiotics that have been prescribed for us by the doctor, and covering our cough and sneeze. I will go into detail in each of these about each of these elements. So, what is a vaccine? A vaccine basically is something that contains inactive antigens. So they could be, for example, a dead virus. A flu vaccine contains dead virus. When you take that vaccine, it causes an immune response in your body, so that your body prepares antibodies. And when you are actually exposed to a real virus like the flu, those antibodies will remember to fight against that infection. And so that is the role of vaccine in prevention of illnesses. There are many vaccines that are available. There is the flu vaccine, the RSV vaccine. RSV is a kind of virus that also causes flu like symptoms. It also causes pneumonia. There is the pneumococcal vaccine. There is the shingles vaccine. So there's different kinds of vaccines that are for prevention of these infections. I wanted to share a personal story about shingles. 4 years ago, my mother had shingles. It took over an entire part of her abdomen. So basically, her shingles went from the right side of her stomach and went all the way towards the back. And so, this is the kind of sores that she had on her skin. And these were extremely painful. It causes a rash. My mother did not have the shingles vaccine. And so, she was a very susceptible individual to get these shingles. Shingles basically is caused by chickenpox virus. So once a person has had chickenpox earlier in their years, the virus stays in the body. And then later, as we age, when our immune system is not as strong enough, this virus can come back and attack the body and cause what we know as shingles. Some of the complications are a very long-term nerve pain. In instances, it could also result in vision loss. 4 years later, my mother still has some nerve pain in her stomach area. And so the Center for Disease Control and Prevention recommends 2 doses of the shingles vaccine for all adults 50 years and older. So I just wanted to share with you this personal story about shingles and how a vaccine can prevent illnesses. Since this incident, both my parents have received both the doses of shingles virus vaccine. So the next topic I'm going to talk to you about is hand hygiene. So there are 3 truths about hand hygiene that I will share with you today. First one, we cannot see germs with the naked eye. We cannot keep our hands germ-free. So germs get on our hands by touching surfaces when you're going to the market, touching your grocery cart, touching vegetables, produce. Basically, any day-to-day objects carry germs. And we can infect ourselves with these germs when we are rubbing our eyes or rubbing our nose, because all germs require a way to get inside our body. So our eyes, our nose, and our mouth serve as important entry points. So I'm going to take this lipstick and I'm going to, just rub it on my fingers here. So what you see here, the red color, think of it as germs, right? So now when my hands are contaminated with germs and I'm going and rubbing my nose, or I'm eating with those contaminated hands or rubbing my eyes, this is going to get inside my body. And that is how people get sick. So we may spread germs to other people by touching surfaces, or we could get those germs to ourselves as well. And so the third truth about germs and hand hygiene or washing hands is that washing hands with soap and water can limit the spread of germs. If soap and water is not available, we want to clean our hands with alcohol hand sanitizer. And so when we use hand sanitizer, we want to take a few drops of the sanitizer and make sure we are cleaning all parts of our hands, all the way up to the wrist, turning it around on our fingers, going between the fingers, and actually getting into our nail pads. Some of the most common areas that we miss while cleaning our hands is the back area of our hands. So we want to make sure that when we are cleaning them, we're doing a great job of covering the entire surface with alcohol sanitizer. When you're choosing an alcohol sanitizer, it needs to have 60% alcohol. It can or cannot be fragrance free. That's according to your preference. And when you're washing your hands with soap and water, you want to wash your hands for at least 20 seconds. Rub it, scrub it exactly the way I showed you, making sure each of your fingers is rubbed and scrubbed before you put your hands under the water to clean them. So we talked about what is cleaning of the hands and how do you clean hands and how often do you clean hands? When do you clean hands? Well, some of it might seem like common sense to you, but I'm still going to call it out. We clean hands before making food, before eating food, because remember that lipstick I put here, we don't want it getting in our mouth, right? Those are the germs. Those represent germs. And so you want to clean your hands before you're cooking food, before you're eating food. If you're taking care of an ill person at home, before touching any item or surface that is touched by others, and then rubbing your eyes. When you go to the grocery store, you know how the handles are sticky sometimes? Those are all the icky germs that are on those handles. So you want to make sure that you're cleaning you're cleaning your hands before you touch your face. And as human nature, we end up touching our faces every 2 or 3 minutes, maybe 8 to 10 times at least. We don't even know that we are doing that. We just kind of go like this or go rub our noses, right? So those are all the ways germs can enter our body. Before, and you always wash your hands after, of course, using the bathroom, touching an animal, blowing your nose, touching garbage, or I like to do it as soon as I come home as well from outside. I clean. That's the first thing I do, wash my hands. Then it begs the question, what about the gloves? Because if you remember, when we were in the midst of the pandemic, a lot of people were wearing gloves and going to the grocery store, because we thought that the gloves are protecting us and keeping our hands clean. Well, in a way, yeah, they were protecting your fingers, your hands, but we would do the same things with gloved hands. So we would touch our noses with gloved hands, rub our eyes with gloved hands. So basically, wearing gloves does not replace good hand hygiene. If that makes you feel comfortable, that's great, but your risk to spread or get an infection is still there. So the best thing you can do for yourself is cleaning your hands. So I hope that helps give you a little bit of tips about hand hygiene. The next one I have is about cleaning and disinfecting. You want to identify all the frequently touched surface in your house. So for example, as soon as you enter your house, the handle of the door, the light switches, those are the frequently touched surface. So when you're cleaning, you want to pay attention that you're cleaning these surfaces as well. You always want to follow the manufacturer's instructions when you're using any kind of cleaners and disinfectants, because for some, you might want to wear gloves. You don't want all the chemicals on your hands. And you want to make sure that you're sticking to whatever the manufacturer is telling you on that instructions. The third area here is antibiotics. You want to finish your entire course of antibiotics. Why is that important? That is important because if you don't finish it, all the antibiotics are not going to get destroyed. And so, when they're not destroyed, you might feel better for a little bit, and then after a while, you might feel sick again. So you do not want to stop your antibiotics, even if you're feeling better, until you have finished the dose that the doctor has advised you. And remember, antibiotics do not kill virus. So when you have the flu, the common cold, all of those are viruses. Antibiotics are not meant to destroy viruses. They're only for bacteria. So do not ask your doctor for antibiotics for a viral infection. Okay. And when you complete the course, it's great. But if you do not complete the course, you also run the risk of having superbugs. So superbugs are special bugs that have been identified in the last 20 years or so. I mean, they've always been around, but they basically cannot be killed by even the strongest dose of antibiotics. And we want to be careful not to develop superbugs, because then we will eventually reach a time where we will not have a single antibiotic left to kill them. So you want to be very careful with antibiotics. Finish your dose just as the doctor recommended. Do not skip them. Do not stop them midway. And more recently, in the last few years, we're also seeing the emerging role of probiotics. So, some doctors recommend that you take yogurt or curd, for example, when you're, taking antibiotics, because they replace all the good bacteria in your stomach. What to do if you're sick? Well, monitor your symptoms, stay home and get in touch with a doctor. And if it is like the flu or something that is transmitted, isolate yourself and take precautions. Follow all the recommendations from your doctor. I'm going to show you how to wear a face mask, because that is so important in today's day and age, how we protect ourselves. So clean the hands like I showed you previously, right? How to do hand hygiene or clean your hands. Once your hands are clean, what you have here, what I'm showing you, is a face mask. You do not want to handle the face mask, touch the inside of the face mask, because that is the clean part. So once you've cleaned your hands, you lift the face mask from the loops here, apply it to your nose or your face, and make sure you put the ear loops around the ears. Your face mask should cover your nose and it should cover your mouth, go all the way under your chin. Many times I see people wearing a face mask like this. This is no good. This does not help you prevent infections. This definitely does not help you prevent infections, because the two places from which viruses can enter your body, the nose and the mouth, is exposed. So when you wear a face mask, you want to make sure you cover all of that. There is a little place here where you want to press so that you have a good seal. When you don't press, when you don't wear it all the way under your chin, you will have little gaps here that will expose your mouth and your nose to the germs. So this is how you will wear a face mask. Now, you will keep the face mask on when you need to. Let's say you want to remove the face mask. You will start with cleaning your hands first. You will never touch the front of the face mask, because the front of the face mask is contaminated. It is contaminated from people who are in front of you, people who are talking to you. So when you touch the front, you contaminate your hands. And remember what I said, when you rub your eyes, rub your nose, you're getting it all inside your body. So once you clean your hands, you want to lift your mask from the loop here, from the ear here, and lift it slowly, ever so slowly, and pull it out, wrap it up like this, and throw it in the trash can. I hope you were able to see it. But you never touch the outside or the inside of the mask, and you just throw that face mask. And a very important point, after you throw a face mask, you want to make sure that you have cleaned your hands again with the alcohol sanitizer or with soap and water. So real quick, in a nutshell, these were the steps I showed you, where you clean your hands, do not touch the face mask, put it on through the ear loops, and then do not share your face mask with anyone. And then the last slide I have here on taking it off, you want to make sure you clean your hands, touch your face mask only from the ear loops, pull it out, do not touch the front because that is contaminated, and then you throw it off in the trash can, and then clean your hands. For those using reusable face mask, you fold the mask and you put it away. You could use a Ziploc bag or a brown bag if you want. And then you can put it for wash that evening. So you could, wash your face mask if you're going to use it every day. So that's about it. That was all my slides I have today to share with you. And I hope I was able to share a few helpful tips with you today. You never know what people are going through in their lives. And so treat others like you're treating your own self. And that is my takeaway message.
Yeah, that's
We say our bodies are temple. Our bodies are our temple. So let's treat them like that.
Beautiful. I like it.